The semitendinosus origin is at the ischial tuberosity. The insertion is at the proximal medial surface of the tibia. The actions are it flexes and medially rotates the knee joint, and it also extends and assists in medial rotation at the hip joint, and it's innervated by the tibial branch. The semimembranous origin is at the ischial tuberosity. The insertion is at the posterior aspect of the medial condyle of the tibia. The action is it also flexes and medially rotates at the knee joint, and it also extends and assists in medial rotation at the hip joint, and it's also innervated by the tibial branch. The biceps femoris is made up of the long head and the short head. The long head origin is at the ischial tuberosity. The short head origin is at the lateral lip of the linea aspera, and they both insert at the head of the fibula. The actions for the long head, they extend and laterally rotate at the hip joint, and both the long head and the short head flex and laterally rotate at the knee joint. The long head innervation is the tibial branch, and the short head innervation is the peroneal branch.
For the semimembranosus and tendinosus manual muscle test, the patient will be prone with knee slightly flexed and thigh medially rotated. The PTA will place hand proximal at the ankle and will ask the patient to flex the knee while keeping the rotation against the resistance. For the biceps femoris, patient will be prone with knee partially flexed and laterally rotated at the thigh, and PTA will place hand proximal at the ankle and will ask the patient to flex the knee while keeping the rotation against the resistance. To test hamstring muscles as a whole, the patient's knee will be slightly flexed and the thigh will be straight. PTA will place hand at proximal at the ankle and will provide resistance. Someone with weak hamstring muscles will present with a gait where the knee is in slight flexion, reduced hip motion, inflection and extension, and a reduced stride length. Weak hamstring muscles can affect the angle of pull at the knee. The quadricep muscles have an anterior pull on the knee, and the hamstrings counterbalance with the posterior pull. If the hamstrings are weak, the balance will be off, and there will be a greater risk of knee injury.